Hello, I'm so pleased to be with you this week and to share some good news that we've seen steadily is a decrease in the number of COVID cases that require hospitalization. That obviously is tremendously positive as we think about whatever that getting back to normal means. But for us, it really does mean that our staff can take a breath and can make sure that we are providing the absolute necessary care as we always have through this entire pandemic. We know the transmission rates are going down. We've been under 1 in the 0.82 percentage for the last 2 weeks. The hesitancy I have, and that you may hear in my voice, is we have not seen the full effect of post-Super Bowl. So we'll watch the numbers this week and we'll see where we are. Now, I know what many are going to say is, Aim, that's all good news, but I need a vaccine. When can I get my vaccine? And the truth of the matter is, as I've mentioned previously, we are almost at the end of all of the patients that we've postponed, the 13,000. I'm hoping that based upon how much vaccine we get at the end of this week, that we'll be able to eliminate that and be able to reopen for appointments. And again, go to the Inspira website and look for those. Continue to remain on the New Jersey State website. We will be providing a town hall February 18th at 2 o'clock to answer questions about the vaccine itself. No, we will not be able to tell you where you can get the vaccine or how you can get the vaccine. It really is about for those individuals that are confused about whether or not to get the vaccine. We will have our experts available and try and answer all the questions that you can. That you may have. We understand that there are over 1,000 people that have signed up to watch the town hall already, so we know there is interest there, and continue to look forward to partnering with you to provide the necessary information to make these difficult decisions. You know, February reminds us that we need to also look back. Dr. Leonard Scott came in 1938 to Bridgeton, and he was the only African American physician in Bridgeton. He was first met when he came to town by the Ku Klux Klan burning a cross on his office lawn. Dr. Scott was denied privileges at the medical center for years, and it was only through the efforts of the first woman who was granted privileges, Dr. Mary Bacon, who ensured, after a long 20-year fight, that Dr. Scott got privileges at the hospital in 1958. The irony for me of that story, which I think is sweet justice, is that Dr. Scott served as president of the New Jersey State Medical Association, and then later in 1968 went on to serve as president of the local Cumberland County Medical Society. These are the stories that we have to remember and have to honor because they didn't happen that long ago. It is a reminder to all of us that we need to make sure that we are doing a couple things. Providing opportunity for people to give their gifts, as Dr. Scott has done to us. To learn the lessons from Dr. Mary Bacon, that even when you get in through a door, you need to make sure that you're still pulling people in with you. And most importantly for us at Inspira, as we face tremendous challenges during COVID and we see limitations of resources, that we never stop pushing to make sure our communities get what they need. And that's the lesson, just like in COVID. We have to continue to do the things that we don't necessarily want to do. We're going to have to wash our hands, we're going to have to wear our masks, we're going to have to remain socially distanced. And until we meet again, I'm going to ask you, be safe and stay well. Thank you.